Nasim from Clemson University. Today I'm going to talk about local inhibition of MMPs in abdominal aortic aneurysm. I'll call it AAA, AAA, because it's hard to tell everything. Abdominal aortic aneurysm with anti-elastin decorated nanoparticles, so loaded with bioengineering. Okay, what is it? It's a permanent dilation in the aorta, in abdominal side, infrarenal aorta, because of the loss of strength and elastic recoil. So looking at the pathophysiology, it's a thinner wall of aorta that it causes bulge formation and tear and unfortunately rupture. So there are historical notes that I would like to talk about that. Maybe it's not important, but it's really important. Look at that. So the first thing is that ancient Egypt it's mentioned that they could actually treat it with magico-religious therapy. We don't know how, but well, they claim that. The first thing is there is someone, father of aneurysm, a Greek surgeon, Antylos. He could actually treat it with ligation of artery above and below the aneurysm, followed by incision and emptying of sac. And the second thing that I'm really proud that I'm doing this research, I'm really not proud that Albert Einstein was suffering from AAA, but it's really important that he died because of this. I'm not proud that he died actually, but it's really important. AAA is really important. So, okay, move on to more serious talk. AAA incidence. It's unfortunately, it is asymptomatic. It means that you never know that you have it. So you go for maybe a headache or something else, and your physician luckily will diagnose you with that. And not luckily, but if you have it. And nearly 2,000 people in the US are diagnosed with that. And unfortunately, 15,000 die in the United States from ruptured AAA. And it's the 13th leading cause of the death in the United States. So looking at the pathogenesis, aging, genetic angiogenesis and atherosclerosis cause this imbalance between the proteases and inhibition of the MMPs. So, and it causes elastin degradation. So MMPs are not bad, but if it's the imbalance between, it's bad now, especially MMP2 and 9. So it causes the release of the elastin peptides, and we have the intensified inflammatory response. And again, we have more MMPs production, especially now MMP9, and we go into this loop that matrix degradation, inflammation, and then MMP production. And finally, we go through this aneurysmal dilation. Looking at the epidemiology, AAA is, of course, more prevalent in older ages. And sorry guys, it's 6 times more in men. So, looking at the etiology, smoking, hypertension, family history, and of course shape and diameter of the aorta. So, treatment option is really related to the size of aneurysm. I made this, it's not a great job, I made it just like 2 hours ago, but it's important. This is the size of aneurysm when it's healthy. So small aneurysm when it's like 5 centimeters or 2 inches, this is a small dilation. If you are in this category, hopefully you don't have, none of us, so not just because you're coming to my talk, I wish nobody has aneurysm. So, but this is a small aneurysm. So if you are in this category, so what is your option? Watchful waiting. What is that? You just like watch it, your doctor watch it to grow. So then you go to the large aneurysm. If you have large aneurysm, then you have 2 options. It's open surgery or stent. So I'm not a surgeon, I don't know which category you go, like open surgery or stent, but The first thing is really annoying, just watchful waiting. So what about that? Do we have any option? Of course, if you can suppress the MMP, it's good. You can actually maybe decrease that progression. So for that, we have MMP inhibitors. But what can you do is that just, of course, like take a pill or whatever other things that your physician tell you. But the point is that MMPs are not bad, right? You just take the pill and suppress MMPs all over your body. But we need MMPs. MMPs are not bad. They're wound healing, tissue remodeling. But what's the solution? We may be able to do targeted therapy. So here is our magic solution. So we need targeted therapy. For that, we need a concept. The concept is that, look at the left picture, is an elastic fiber that is healthy. Hopefully we all have this in our aorta. So this is an elastin fiber that is healthy. It doesn't have aneurysm. So it's nicely wrapped with microfibrils, and the elastin core is not exposed, right? But if we have aneurysm, in some part, elastin core is exposed, and that's our concept. It's not good, but it's the concept that if we can design a nanoparticle that is decorated with anti-elastin, it can go and attach that exposed elastin. So with this concept, that we have published a paper on that, now we can have nanoparticles that we can load a drug like an MMP inhibitor like bioengineering doxycycline into that nanoparticle that is decorated with anti-elastin, and hopefully they can go into the bloodstream and then go to the site of injury in aorta and release the drug and suppress the MMP and prevent AAA. Okay, this is the characteristic of our nanoparticles. The method is nanoprecipitation, drugs to polymer ratio 5, loading 6%, yield 40% size, about 200 nanometer, and the potential about minus 30. So next question is that if we go through this process, if the BMES state in this case is still active, the way that we did, we extracted the BMES state and used it in gel zymography. And the result was, yes, the drug is still active. Based on the result, we moved to our first in vivo study. We have a well-established method for inducing aneurysm, that's a calcium chloride injury. We expose the abdominal aorta and wait for 10 days to let the aneurysm develop. And then we had multiple groups, DIR group, BB94 group, blank and IP group, that is a systemic group. And after 2 days, we harvested the organ, that is aorta. So here we have this DIR fluorescent dye nanoparticle group to make sure that we are targeting the abdominal aorta, not the thoracic aorta, in the same animal. This is the same animal, not two different animals, as you can see from the fluorescent dye. And then looking at the MMP inhibition, you see in these two groups, in the systemic group and also the group that got the blank nanoparticles, we have about 150% of the MMPs. This is how we reported abdominal aorta over thoracic aorta. So while in the blank, in the BB94 group nanoparticles, we have about 100% reduction. So to just give you an idea here, the more green that you see, the MMPs are more active. This is the non-treated group that you see, and this is the treated group. So based on this result, we moved on to the therapeutic effect, and everything is the same, except here, all the condition is the same, but we wait for 28 days to see the actual therapeutic effect. And here you see the targeting. We still could target. This is the abdominal aorta. And here we have 76% targeting to the aneurysmal aorta, injured aorta. And here is the actual result that you clearly see the dilation, the size of the aorta in abdominal side. Here is the BB94 group, here is the blank group, and here is the size of aneurysmal development in non-treated group, 269%, while we have 56% in the treated group. Here is some histology of H&E. You see a big difference in blank nanoparticle. We have a lot of calcification and inflammation in here of blank nanoparticle non-treated group, and BB94 treated group. You see that pretty much everything is preserved, no inflammation. Also, we did some VVG staining. You see that in the non-treated group, we have whatever black you see is elastin. So you see that the elastin is damaged. This is what we expect in aneurysm, and we see it in blank non-treated group. Well, in BB94 group, that is the treated group, we see that elastin is preserved. So the conclusion is that these NPs can be delivered to the site of aneurysm, and we can suppress MMPs, and more important, we can prevent aneurysmal development. So future work, we want to look at the toxicity of MMPs, toxicity into the organ, and probably looking at the other models and larger animals. So I would like to acknowledge our funding and Dr. Nahar and Cedar Lab and our animal facility, and also to all the rats that sacrificed their life for us. And thank you, and I'm here to answer any questions.